Thank you so much for having us be part of this event. So as mentioned, I'm a researcher with the Montreal AI Ethics Institute, as well as a researcher for OCAD University here in Toronto. I'm here with two wonderful colleagues from the Montreal Institute, Alison and Eric. And we're going to talk a bit about the Institute, as well as a recent paper that we worked on. So we'll start with some intros, and Eric will go first.
All right, great. Hi, everybody. I want to apologize for not having my camera on. I got stuck at the car dealership, but such is life. Anyway, I am a researcher with the Montreal AI Ethics Institute. I am also an AI researcher at Rapid7. I specialize in breaking and fixing and preventing the future breaking of AI systems. So that includes our adversarial machine learning, model inversion, and other sorts of security attacks on those systems.
Thanks, Eric. So hi, everyone. My name is Alison Cohen. I am also a researcher with the Montreal AI Ethics Institute. I actually have a background in international development and global affairs, and that educational background has really imparted on me the importance of AI design that is very inclusive and considers the perspective of multiple stakeholders. And as a result, I really enjoy researching both from a technical and non-technical perspective, strategies to improve AI fairness, transparency, and accountability. And that's part of the reason I'm so excited to be joining you today to talk about this topic, which I find so fascinating. And if we switch to the next slide, I can introduce everyone to a bit of the work that the Montreal AI Ethics Institute is doing. So just to give you some brief background, we are an international nonprofit organization with the explicit mission of trying to define humanity's place in a world that is increasingly characterized and driven by algorithms. And what that really means is we are trying to insert ourselves into the conversation that is developing, which we believe is really informing this framework and foundation in how AI will continue to impact humanity for years to come. And we really do this by creating tangible and applied technical and policy research into the ethical, safe, and inclusive development of artificial intelligence. We have a very strong and vibrant community of members that we like to consult with. They have a variety of academic backgrounds, and through this consultation, we are able to really gather a multi-stakeholder perspective and analysis on developments in artificial intelligence. And in turn, we like to engage in lots of capacity building when it comes to public competence in this area. And if you're interested in how we do that, please visit our website at montrealethics.ai. Thanks, and back to you, Tanya.
Perfect. So we recently worked on a paper titled Participatory Design to Build Better Contact and Proximity Tracing Apps. The paper really calls to attention the current distrust felt between citizens and authorities that are deploying or are considering deploying contact and proximity tracing solutions. We argue in this paper that the apps are not being developed in a transparent way, and this greatly hinders the initial and long-term uptake. In this paper, we proposed that the use of participatory design from conception to deployment as a means to co-create an app for specific community needs would result in better uptake and more effectively meet user needs. In the paper, we also dived into the role of the Bazaar model. This model embodies the open source software movement and relies on collaboration and openness in development. And then our last slide. So the key takeaways for this paper include, as we mentioned, trust as social fabric and the importance of participatory design. What makes participatory design unique is that it includes all stakeholders of an issue, not just the users, and utilizes the input across the entire research and implementation process. Solutions thus far for contact tracing applications have been predominantly built by deeply technical communities in isolation. Participatory design encourages the process and legitimacy of having those affected by new technology be involved in its design, and therefore the product is built with specific community needs and understanding in mind. Participatory design also aims to solidify trust through the equalizing of power, recognizing the lived experiences of participants and the mutual goal of creating a useful outcome that can aid in the empowerment of communities. And the last takeaway, Eric will speak to the bazaar model as well.
Yeah, thank you so much. So the bazaar model comes from a long-form essay turned into a book entitled The Cathedral and the Bazaar by Eric S. Raymond. The idea is that in the cathedral model, you have this large, hierarchical, pristine, building, right? This thing that has been designed from the ground up by people who have a particular design in mind, and everything has to adhere to that sort of canonical singular design. In the bazaar model, different people build different bits and pieces on top of a common framework, and that common framework really forms the foundation of the bazaar. And within the bazaar, each person can build whatever application they feel is the most suitable. So it's really a much more equitable and, individually focused design model than something that is more hierarchical.
Wonderful. Thank you, Tanya. And thank you to the Montreal AI Ethics Institute. We are excited to introduce our next speaker, Renee Cummings. She is a criminologist, criminal psychologist, AI ethicist, and data activist. She specializes in diverse, equitable, and inclusive AI design, development, and deployment, principled, responsible, and trustworthy AI strategy, ethical AI policy development and governance, and AI risk management, AI crisis communication, and using AI to save lives. She is a Columbia University community scholar and the founder of Urban AI. So without further ado, we welcome Renee Cummings.
Thank you so very much, and it's certainly an honor and a pleasure to be with you. Are you hearing me?
Perfect, thank you.
Fantastic. So let's just jump right in and move to the first slide. When we think about the pandemic and when we think about COVID-19 and the question of racial inequity, I think for me it's really considered the pandemic of pain, and that's what we've been seeing. Where COVID-19 we are seeing that grief, the inability to grieve. That's one of the biggest pains that people have been speaking about, individuals, loved ones who are dying and there is no closure. We know with this pandemic, there is also a mental health crisis. There's a financial crisis. We know that several months of lockdown and isolation has created other aspects of trauma and post-traumatic stress that's now being played out. When we think of racial inequity, we are seeing similar types of pain, and this pain has been historic because we're dealing with issues of systemic racism, structural racism, institutional discrimination, and that pain, centuries of pain in communities of color, it's been intergenerational. We know there's that situation where there is no justice for many of the issues that we have seen in communities of color. We know mental health, financial health, issues such as redlining, cultural dislocation, and the criminalization of color has created also a very similar pandemic that deals with systemic racism. You can change the slide. COVID-19 in particular looks at the death of people of color, and while there are many communities who are impacted, much of the focus in the US and the UK has been on communities of color, pre-existing conditions like chronic lung disease, serious heart conditions, being immunocompromised, hypertension, diabetes. And these are correlating with the kinds of issues that we're seeing when it comes to systemic racism, the disparities, and the inequalities, where people of color have also been dying because of centuries of police violence and psychological violence because of that police violence. When we look at health disparities, and we're moving to the next slide, we see that Black, Indigenous, people of color all impacted, Black and African American, Hispanic, Latinx, American Indians, Alaskan Natives, Asian Americans, Pacific Islanders, all these communities seriously impacted by COVID-19 because of what we are calling that complex interplay of underlying inequalities, historical racial biases in diagnosing diseases. And we know that medical textbooks don't really focus on Black and brown people. Social, economic, environmental, political, all of these interplay to impact the disparities that we're seeing when it comes to healthcare. Of course, the question of multi-generational and multi-family households, and the fact that social distancing becomes a privilege in those households, very important. And when it comes to the Black American community in particular, a recent research study, you can change the slide, looks at the impact of COVID-19 on that community. And what we're seeing is that the impacts of COVID-19 are very similar to other pandemics that we've seen, HIV, things like air pollution, cancer, low birth weights, several of these issues very similar. And what we're seeing is those correlations in the Black community between COVID-19 and disparities when it comes to something like race determining your residence, employment opportunities, being uninsured, limited health system capacity, and all of this happening in underserved, marginalized, high needs, disinvested communities. As we move on, you could move the slide, we're seeing that correlation between healthcare and racism. And the issues there would definitely be that health and racism correlate in this very unique way, where racism is a social determinant of health. It's also a driver of ethnic health inequalities. Exposure to racism is correlated between poorer health outcomes. The negative impact on the access to healthcare is also correlated with racism. And we know that when it comes to racism and patient experiences, there are definitely inequities and disparities there. You can change the slide. When we think about COVID-19, and I just want to give you a little bit of an international perspective, the same issues we're seeing in the US as it pertains to the Latino, Black, Native American communities are the same as disparities we are seeing in the UK, in the Black, Asian, minority, ethnic groups. However, in the UK, the Bangladeshi, Pakistani communities hit hardest, and then followed by the Black. In New York, the Latino community impacted more. As we move on, we realize, and you could change the slide, that why are these communities impacted? Because these communities provide our essential workers in the service industry, healthcare, public transport, care work, cleaning jobs, security jobs. We could move on with the change slide. The other thing that you want to think about, particularly when it comes to AI, healthcare surveillance and criminal surveillance. Now, I'm a criminologist, I'm an epidemiological criminologist. I deal a lot with urban criminology, and I also look at systemic racism in policing and national security. And what we are seeing is a systems integration between healthcare and criminal justice. The systems in the fact that how we're doing the contact tracing, how we're doing the monitoring, how we're doing the testing, things like isolation, geofencing, apps, quarantine violators, threat mapping apps, and even the search for a vaccine. All of this in the collection of data, and we're seeing that that data is now being combined with criminal surveillance. Why is this? Because now public health is public safety, and it's about public security. And because of travel restrictions, we will start to see it as really a national security issue. And we are seeing that systems integration between healthcare, big data policing, digital and racial profiling, predictive policing, and racially targeted surveillance. You can move the slide. Why is this happening? We know that because of AI, this pandemic is now the perfect territory for a grab, an aggressive grab of data acquisition. We know that data is power. We've been hearing the experts speaking about the digital Cold War and that fight for technological dominance, disinformation, and propaganda. Big tech is using healthcare, using this pandemic to build an artillery of AI firepower, what we're calling AI expansionism, where data could be used, if we're not careful, as a mechanism of social control. I'll change the slide, thanks. What we're also seeing are issues now of surveillance capitalism. And what we're seeing with the systems integration between healthcare and criminal surveillance is a continued oversampling of underserved communities, excessive, intense, intrusive surveillance to track the pandemic at scale because of the potential and the power and the promise of AI. And we're tracking the same community over and over, our vulnerable communities. We've got to think about things like totalitarian surveillance because of AI. And one of the things that we're also seeing because of the pandemic, because of the need for healthcare, the need for clinical care, is that we may be called upon or forced by forced consent to surrender our rights when it comes to this pandemic to ensure that public safety is part of that social responsibility. Feel free to change the slide. The other thing that we've got to think about when it comes to AI would be ethical concerns, because we know this data system integration between public health and law enforcement is going to present many, many challenges. It has already started. We saw that the same techniques used for contact tracing were used in Minneapolis to track Black Lives protesters and other protesters. So we know it's being used by the FBI, by the DEA, by ICE already. AI relies on large data sets that is rife with ingrained cultural prejudices and structural hierarchies, and systemic racism really is baked into the data that we've been using to design these AI systems. We've got to look at the balance between deploying AI and to keep healthcare data safe and protected. So that question of data privacy and the deployment and the design and the development of AI systems, very important. We know that the data is required in this pandemic to save lives, but we've also got to think about whether or not this data is going to be weaponized against us post-pandemic, in a post-pandemic reality. And we know that we need the data to save lives, but one of the questions that I want you to ask moving forward is, will these AI systems deployed during a pandemic be dismantled after it? We've got to be really critical. We've got to be critical thinkers. We've got to understand what is going on, that correlation between COVID-19, structural racism, and how it's being used at this moment. One of the other things that we've got to think about would be other issues that are going to be created when we look at how the pandemic has impacted something like rent, evictions, and the kinds of disabilities that are going to be created, particularly health disabilities moving forward as well. So when we think about COVID-19 and racial inequity, we're really thinking about centuries of systemic racism. And I think now, because of the Black Lives Movement, because of the murder of George Floyd, everything that was percolating actually erupted. And this is why we are here and having this conversation. Thank you.
So if anybody has any questions for either Renee or Tanya or the Montreal AI Ethics Group, please feel free to either say it in the chat or just unmute yourself and ask right now.
Yeah, I have a question for Renee. Thank you very much for that speedy talk. I had to keep up, to be honest, with my notes. What do you think, what can you say about anonymization of the data during and after? Have you any points about the anonymization?
Thank you so much. Are you hearing me?
Yes, yes.
For me, where there is anonymization, there's always the ability to ensure that data could also be identified. I think one of the things that we've got to think about is, how is it going to be collected? How is it going to be used? How is it going to be shared? Is it going to be shared across different international jurisdictions? We've also got to look at the question of how it's going to be disposed. Do I have the right to be forgotten? There are some major questions there when it comes to safety, security, and privacy, and we're not having those discussions just yet. As someone who works in the realm of data activism and AI ethics, these are critical conversations that need to happen, because we know the concern with AI is still one of trust. So issues such as fairness, accountability, transparency, explainability, these are big issues, but we've got to start to have those conversations. But the first conversation we've got to have is how oppressive the data is, and whether or not we can remove from the data sets that we're using centuries of structural racism, centuries of systemic racism, centuries of institutional discrimination. So that's a big question that you've asked. The answers are not yet available, but I think as a community, we have got to deliver those answers. But thank you for the question.
All right, welcome back. We are looking forward to introducing our next speaker, Jennifer Williams. She is a data-oriented diversity, equity, and inclusivity expert with experience crafting nimble, people-centric policies and programs for companies of all sizes. She is passionate and intentional about creating world-class employee and organizational experience. And she is a native Washingtonian before she quickly fell into HR upon moving to New York. She has over 15 years of various experience in various industries. And with that, we are excited to welcome Jennifer Williams.
Thank you. Thank you so much. I'm so pleased to be here. So I'm briefly going to unpack what I like to call the what behind the why, as we are talking both about how Black and brown bodies are falling at rapid rates to the pandemic that is COVID. But there is a bit of understanding that needs to occur to understand the true reasons why, or the what behind the why of what is occurring. I began with something that I believe that I have heard every older Black elder in my life say, in some way, shape, form, or fashion: when America catches a cold, Black people get the flu. And that is endemic of both Black people and brown people, essentially usually receiving the short end of the stick when something happens. If something bad happens, it tends to fall on the Black community and harm us even more. And in spaces of COVID, ensuring that we understand the what and why we're getting to these places. I am sorry, there's loudness outside. Ensuring that we have an understanding of how we've gotten to this place. As I want to get into the narrative a bit deeper. Renee began, I want to continue that conversation. Blacks, relative to whites, are more likely to live in neighborhoods with a lack of healthy food options, green spaces, recreational facilities, lighting, and safety. These subpar neighborhoods are rooted in the historical legacy of redlining, and additionally, Black people are more likely to live in densely populated urban areas, which further heightens potential contact with other people. And as we know, especially with the way that COVID is being transmitted, the closer you are in proximity in places that are not well ventilated, the more your risk increases. As well, Black people represent about 1/4 of all public transit users. So I'm here in New York, and I remember at the beginning of the pandemic seeing photos of Black and brown people packed inside of subway cars, and the narrative being, oh, they need to socially distance. And my response was always, how privileged you are to think that the ability to socially distance when you are someone who is now considered an essential worker is something that you can do, when everything is running on a differentiated schedule and it's difficult enough to even navigate getting from point A to point B. So the understanding that the way things have been set up makes it even more difficult overall for Black and brown individuals to subsist in this landscape. Black people are also less likely to have equitable healthcare access, and that means that hospitals are farther away and pharmacies are subpar, which leads to more days waiting for urgent prescriptions. So health problems in the Black community manifest not because Black people do not take care of themselves, but because healthcare resources are inadequate in their neighborhoods. And I think making that distinction is extraordinarily important. When we talk about work, Blacks are certainly more likely to be part of this new essential workforce that COVID-19 has created. Black people represent nearly 30% of bus drivers, nearly 20% of all food service workers, janitors, cashiers, food stockers, etc. And during a highly contagious pandemic such as this, Black workers and consequently their families are overexposed. And so in this regard, I continue to hear, and you would see these missives, stay home, stay out. Staying home during a quarantine is a privilege. And the need to humanize these statistics is super important, because when you're not aligned with them and you're not close to them, it's very easy to look at people's actions as reckless, when in essence, they are just trying to do what they can to survive. Next slide, please. So life, liberty, and the pursuit in an ableist society, and aiding people in understanding that access is akin to privilege. Life, liberty, and the pursuit of happiness is something that you feel is your inalienable right as an American citizen. It's what the underpinnings of our democracy is built on. You're a Black person, we're just on the life part. And I want to be very clear about that. We've not yet gotten to liberty and the pursuit of happiness. We are trying to live. It is why when we have conversations about Black lives mattering, you have to understand how low the bar is. Not Black lives are better than, not Black lives are exceptional. Black lives should just matter to you. And the understanding of access versus privilege, I want to take it a step further, especially in the healthcare and ableist society. Not having to take medicine is a privilege, but if you do have to take it, access and getting a diagnosis is a privilege. On top of that, feeling safe to be able to disclose your specific medical needs, or if you have a disability, being able to disclose that safely to someone that you can trust in the healthcare field is also a privilege. We inherently live in an ableist society that values the lives of people who are less productive in the capitalist sense as lesser. So this system is one that does not grant access to healthcare as a basic human right to very many. And Black people overwhelmingly are not given this right. I routinely see the slide that speaks to how many people have lost their healthcare since the beginning of COVID-19, and especially in the States, the conjoining of your employment with healthcare inevitably means if you lose your employment, you probably have lost your healthcare. And hundreds of thousands of people that are no longer employed are also now uninsured and are having issues and challenges with being able to ensure that they get the medicines and the healthcare that they need. If we do not fight for access for all, we are failing, and we are very much complicit in the same ableism and this deeply rooted oppression. Black communities are less likely as well to access mental health care through a primary, and they're more likely to end up in crisis care. And Black people overall with physical or cognitive or intellectual or mental disabilities experience amongst the highest rates of violence and discrimination. So next slide, please. An understanding for the need for a social justice lens is one that is very real, especially when we're talking about healthcare. Primarily, an understanding that social justice is the view that everyone deserves equal rights and opportunities, and this includes the right to good health. Yet today there are inequities in health that are avoidable and unnecessary and also very unjust. These inequities are the result of policies and practices that create an unequal distribution of money, power, and resources amongst communities, again, based on race, class, gender, place, and other factors. To assure that everyone has the opportunity to attain their highest level of health, we must address the social determinants of health and equity. Racism and other forms of structured inequities sap our potential to becoming the healthiest nation. If we just look at healthcare costs right now, more than 30% of direct medical costs faced by Blacks, Hispanics, and Asian Americans can be tied to health inequities. So because of that difficulty of getting access to care and other health promoting resources, these populations are often sicker when they do find a source of care, and they incur higher medical costs. And just to give that some more tangible roundness, that 30% translates to more than $230 billion over a 4-year period. That is what that inequity costs. If we also look at overall healthcare and criminalization, this plays a large role in racial health disparities. Black men report, especially during COVID-19, being stopped in stores by police for wearing PPE like masks, when those are now things that are seen as essential and necessary to go inside of stores. So think of this. You are inherently being targeted for doing the thing that can save your life and ensure that you do not provide sickness to others by virtue of racism, by simply existing. Also, understanding that the mask in and of itself should signal a health precaution. It can signal potential criminal behavior if a person is Black or is brown, which is also a difficulty that is very real. If we move further into outdated racist beliefs ascribed to Black people and pain, the understanding, and these studies were done just as recently as 2019, a handful of doctors in various environments that were training very much believed that Black people did not experience pain in the same way as white people did. In 2019, in 2020, the belief that pain is not universal, that Black people don't feel it the same way, that they're impervious to feeling certain things. We're then going to go into the high cost of medical inequity. That $230 billion drives up everyone's healthcare costs, especially from a premium perspective in the US, where we do not have a single payer system and where most individuals are able to get care by virtue of getting their jobs. So their jobs are their access to care. I'll take it one step further and having a conversation in the Black maternal mortality rate, and this is something that is very personal to me, again, as a Black woman. Black women are between 3 and 5 times more likely to die in childbirth than a white woman. And this is outside of understanding their social economic issues, their status in life, so on and so forth. I, as a Black woman who is upwardly mobile and professional, am almost 50% more likely than a white woman to die in childbirth. With all of the access and all of the information and all of the understanding of what needs to be done, I still have those staggering figures in front of me. So ensuring that we take all of this, especially in the lens of ensuring that we understand what data does and how it can be utilized for good and for bad in this situation, understanding that there needs to be an equitable, just social justice lens when we are talking about healthcare and we're able to ascribe it to everyone so that everyone can move freely and fairly in these systems.
Thank you, Jennifer. Next, I'd like to introduce Lana James, who is a doctoral candidate at the University of Toronto in the Faculty of Medicine.
Hi, if we can go to the next slide. So what I'm going to talk about today is the conceptual challenges that we have with ideas of inequity, especially racial inequity during COVID. And one of the things that I think is really important to stress is that much of the kinds of interventions that are kind of promulgated and circulated, whether it's transparency, accountability, explainability, or any of those models around, quote, bias, in AI and machine learning, particularly where it comes to health and public health, one of the key issues that we have is very few of the people who are coding or who are producing these interventions, whether it's in the hospital system, whether it's a statewide system, they're often not bringing a close relationship between what's going on in code and what's actually happening at your human rights level and or your constitutional level. And I think it's a really big problem because when people come to me and they say, okay, my work is around AI, I work at the intersection of racial medicine and also the law and machine learning and clinical care, and particularly I look at diagnostics and assessments. One thing that's very profound is that often the tools are becoming the carpenter. So we have a situation where machine learning experts and AI experts who have no training or sufficient training in public policy and long-term implications and unintended effects, and almost no training at all in racial capitalism are now designing interventions. And so I've had folks who are like so geeked, so happy to share their intervention. And I'm like, can I see the equation in the code? And I'm like, okay, so what were we thinking was going to happen with this intervention? And part of it is because they think that you can address this piece of a thing when the reality is that society has been structured according to racial capitalism, meaning white supremacy reigns. And so the whiter and lighter that you are and where you sit within Empire of Europe, the more likely that that code has been designed to facilitate the world post 1492 terra nullius, which is the idea that Europeans ran around the world claiming things and stealing things that they did not own. That is in every data set. That is the home of every training set. And so on your slide here, you have, for instance, I'm from Canada. I'm residing here in Toronto. And I just want to give a quick acknowledgement to the Mississauga of the Credit First Nation, the Anishinaabe, the Haudenosaunee, the Chippewa, and the Huron-Wendat nations on whose land I reside. And so when we look at this report that is about people of African descent, and there is a substantive population of Black people in Canada who also are Black and Indigenous, one of the issues that we have here is when we look at what's happening in our AI institutes, we have almost no real commitment to making sure that we code for the human rights, that we code for the Constitution. And in fact, what's happening is the $100 million that's been invested year over year over the last 3 years has actually deepened algorithmic racism and refurbished apartheid, what I describe in my PhD work as AI apartheid. And that's a deep problem because this document, as you can see, is from 2017. If we can go to the next slide. Right here, this is what the UN Working Group said, and I'm going to read it out. Despite Canada's reputation for promoting multiculturalism and diversity and the positive measures taken to address racial discrimination, the Working Group is deeply concerned about the human rights situation of African Canadians. Canada's history of enslavement, racial segregation, and marginalization, all things Canada decides or hides on the global stage. So people often have this wonderful narrative from Harriet Tubman of the North Star. But what is often sequestered away from eyes is that Underground Railroad only lasted for approximately 30 years and Canada had slavery for 200. Not only that when the proclamation was read out on the US side, over 20,000 African Americans who had fled immediately poured across the border because the conditions here were so hostile. I'm now going to skip down to the last line, which says history informs anti-Black racism, racial stereotypes, and are so deeply entrenched in institutions, policies, and practices that its institutional and systemic forms are either functionally normalized or rendered invisible, especially by the dominant group. And so in Canada, as it is elsewhere in the world, because the big six are the primary providers of all of the tools that we use in Canada, we have basically, much like our premiers who look all the same, we have largely white, heterosexual, cisgendered men coding for us, and we have their female counterparts. And so one of the deep concerns about what's going on in relation to equity and COVID is very few, and at some point I'm going to take a time to do a closer analysis, but I would hazard that less than 5% of anything that's been produced during COVID actually meets our Ontario Human Rights Code or our constitutional protections, because almost none of it has been considered. And we have ongoing articles being produced by our top universities that reinstate the stigma. If we can go to the last slide. And so I use the work that we do here at Ready for Black Lives, which is an initiative that I co-lead. It has a number of parts to it. One is a protocol to deal with data and AI, particularly for Black populations in Canada. Another component is something we call the COVID conversations. We had the COVID conversation symposium a month ago, and then these follow through. And in our upcoming lineup, we want to address very directly for the mathematicians, for the coders. We're having Jack Polson and Kathy O'Neill, and we're going to be in conversation, kind of talking about that from a Canadian perspective on what you can do and how we need folks to think through this, because algorithmic racism will continue to persist because the people who produce the code are of the class of the same, and they're of the class of the individuals of the ancestors who produced racial capitalism and racial segregation. So it's a bit odd to think that we can end up somewhere else when 90% of our coders are part of the same structural racial class that created the context and the conditions that we live in. And so what I propose is that if you're coding and you can't figure out how the Constitution and the code go together, you need to constitute a team that makes that possible. And it's not an individual, it's a team. And we have to stop allowing the tools to become the carpenter and make sure the carpenter doesn't think it's the architect, because those are three very different roles. And right now what we have running amok is, as we say, everything but Black, anything but Black can take center stage, whether it's coding or financing, and that creates a world in which some of our lives are already extinguished before they've even begun. And I'm gonna leave it there.
I want to thank Lana once again. And I want to remind you guys, if you want to see more content related to this, feel free to hop on over to ai.science, which is the website for Aggregate Intellect.